Well, thank you very much for being here. This is a session on environmental health. Good afternoon. I'm Victor Zhao, the Chancellor for Health Affairs, and it's my great privilege to moderate today's panel on environmental health as part of this inaugural event. Really commencing the work of Nicholas Institute for Environmental Policy Solutions. Thanks to extraordinary generosity of Pete and Ginny Nicholas, we're able to bring together the world's best scientists, social scientists, and researchers to develop analysis and solutions to the most challenging, important issues facing the planet. Certainly, the issues and problems in environmental health are some of the most complex, not just from the scientific perspective, but also from, as you heard, political, social, and economic platforms. I can cite you many examples. You already heard some of them. Examples such as Chernobyl, 3 Mile Island, lead poisoning, Katrina, many others. I think today's environmental health topic is especially relevant and timely in view of the Gulf Coast hurricane devastation and the squeal of events is certain to ensue as politicians, activists, citizens, business leaders, environmentalists, and other concerned parties begin grappling with the immediate and long-term impact of such environmental devastation. Recognizing that many global health problems stem from economic, social, environmental, and healthcare inequalities, the leadership at Duke, President Broadhead, initiated the Duke Global Health Initiative. And global health brings together the multiple discipline and an interdisciplinary team to work with partners to solve the highly complex health problems to train the next generation of global health scholars. And as a leader of a large academic health system, I believe the issue of environmental health is critical as we identify preventive mechanisms or measures for health. It is important to evaluate the causes of disease, prevention of such disease, not only individual but in populations. By focusing on environmental health, we're able to better improve the health of entire populations. This is why the Institute on Environment will play a very important role in Duke's Global Health Initiative. Global health is not only a moral imperative, but a key to global stability. To this end, our distinguished panelists was posed with 3 critical questions. First, what are the great environmental problems in environmental health? Second, what are the political, social, and economic barriers to addressing them? And third, what can this institute do to help tear down these barriers? See, you're taking notes. You want me to say it again? Okay. So each panelist will share with you her or his thoughts on these questions based on their perspective and expertise. Let me first introduce the panelists to you. To my extreme left is Michael Depledge. He's the head of science at the Environmental Agency in the United Kingdom. Dr. Depledge will focus on health of ecosystems and the consequences of human health, including his work on endocrine disruptors and genotoxins. He will also provide a European perspective on barriers preventing the application of sound science to policy solutions. On his right is Linda Birnbaum, Director of Environmental Toxicology and the Division of Environmental Protection Agency. Dr. Birnbaum, whose work on dioxins and hormone systems had been really essential in helping us understand and should discuss pollution as a global, not just a local health problem, which knows no boundaries and how pollution impacts developing and developed countries and how certain subpopulations are more sensitive than others to pollution. And last but not least, our own Miranda, the Director of Children's Environmental Health Initiative and Associate Research Professor at the Nicholas School at Duke University. Dr. Miranda will focus on environmental health risks to vulnerable populations, particularly to children, the socioeconomically disadvantaged, and people of care. Her groundbreaking work with the hurricane relief effort you might have seen appeared in the Washington Post on September 19th. And she'll demonstrate some of her technology, the Geographic Information System, or GIS approach, for addressing these issues, using Hurricane Katrina disaster mapping as a case study. So please welcome our panelists. So according to the program, I'm going to start first with Dr. Birnbaum. Each panelist has 8 to 10 minutes. I think all of them have visual aids, I believe. And at the end, we'll have an opportunity to have a Q&A and panel discussion. Linda, would you like to come up here or stay there?
I think I'm fine here.
Great.
First of all, it's really a pleasure to be here. It's been a fabulous morning so far, and the afternoon is just beginning. And it's very, very exciting for me to be able to participate and for the opportunity for us to dialogue on some of the issues that I think are really important for us to recognize as we move forward in the issue of environmental health. And I'm just going to say it once, and it'll come up again, but the health, public health, is not independent of the health of the environment. These are two interrelated issues, and we cannot look at one in total isolation of the other. So the first point that I wanted to make when we look at, or what I see are some of the great environmental problems, is that no longer is pollution local. All pollution is global. Pollution travels, so that whatever we produce here moves, and whatever is produced elsewhere comes and affects us. And just a couple of examples. One is the toxic cloud, which migrates across the Pacific, takes about 5 days for the pollution that is generated at very high levels. For example, in China, many developing countries are repeating all of the mistakes that we've made, and that pollution reaches our shores about 5 days later. We've already heard from Professor Diamond about the issue of, for example, the TVA and the power plants impacting, for example, North Carolina. We also know that much of the problem in acid rain was due to the coal-fired power plants that we had in the Midwest. Again, it's not, the pollution can be produced one place and impact another. A third example, which is very well known, is our contamination of the Arctic. The most pristine environment on Earth, or what should be the most pristine environment, is heavily polluted not only by radionuclides, but many different kinds of chemical pollution. In part, this is due to what's called the distillation effect, where chemicals volatilize at relatively warm temperatures, either in the, say, in the temperate clime, and then precipitate out and come down with the snow in the north. We also have the movement through the oceans, which moves things north, and we also have the biomagnification up the food chain, so that our, say, marine animals at the top of the food chain, our polar bears, our seals, for example, are the most heavily contaminated animals on Earth, and our native populations in the far north are the most contaminated people on Earth. The second kind of environmental problem that I wanted to talk about is the issue of the developing world, and I already mentioned, I made the comment that, for example, the developing countries are frequently making the mistakes that we made. In the developing countries, you're dealing with high levels of pollution, acute exposures, as well as the potential for long-term exposures, and a lack of recognition and attention to the problems that they're creating for themselves. Now, when I say that, one example I wanted to use was the example of arsenic in drinking water. In Bangladesh and in West Bengal, in Inner Mongolia, in North Vietnam, as well as other places in the world, in order to avoid the problem with contamination of surface water by microorganisms, tube wells were drilled to go into the aquifers to provide safe drinking water. The water came up was clear, it was clean, there were no microbes. 20 years later, we found out that they drilled into geological strata that had high concentrations of arsenic. And we now have millions of people who are suffering from frank arsenic poisoning, for example, in the countries that I've mentioned. We're not, again, dealing with a low-dose effect. We're dealing with very high, very real problems. Another example is, for example, discarded electronic waste. In this country, we have rules about recycling. We have certain controls about how we do landfills. This is not true in many parts of the developing world. And you can easily, for example, go on the web, look up electronic waste, and get pictures of piles and piles and piles of waste. We know, for example, there was a recent study that I just reviewed coming from Nicaragua, where children who are living by this waste have very highly elevated levels of pollutants because of this electronic waste that they're living near. The other issue is banned pesticides, where I think many of us know what happens to pesticides that we can't use here. Well, some of them get shipped overseas and are used in less developed countries. The third issue that I wanted to mention, and this is going to overlap a little with what Lynn's going to talk about, is the issue of susceptible populations. And I'd remind you that you can be susceptible for two reasons, and they often overlap. You can be susceptible because you're more highly exposed. So just think of the little child or the toddler or the infant crawling around on the floor, putting their fingers in their mouth all the time, sucking on Bunny Rabbit's ears. Well, Bunny Rabbit just happens to be loaded with lead. Okay? So there's more exposure, therefore there may be increased susceptibility. There can also be increased susceptibility because of inherent sensitivity. The developing child is inherently a sensitive population. In some cases, one gender may be more susceptible than another gender. Nutrition status, disease status can all alter your susceptibility to different kinds of exposure. And we know well that your genetic makeup can, in fact, alter your susceptibility. So, for example, there are several very important studies showing, for example, that asthma can be associated with environmental tobacco smoke. But in fact, if you basically are missing a certain enzyme which is involved against certain defense mechanisms, then in fact, you are much more likely to develop asthma if your mom or your dad is a smoker. Another example is liver cancer. Now, liver cancer has not been a major problem in the United States, although it is rapidly increasing in our population. But it has been a major problem in much of the developing world in association with hepatitis virus infections. But now we also know it's not only the hepatitis virus infection, it's exposure to a kind of product from a certain kind of mold that's often found on corn. You also find it in peanut butter. But again, if you have a certain genetic predisposition, you are much more likely to develop liver cancer when you have this combination of circumstances. So susceptibility can be because of genetics, can be because of age, gender, disease, diet, and exposure. The fourth environmental problem is sort of an overarching one, and that's we live in a soup. We are never exposed to one chemical or one stressor at a time. In fact, we are always dealing with the issue of mixtures. And very frankly, the regulators at least don't know how to deal with this issue. We have got to begin to deal with the fact that when we regulate one chemical at a time, we're not taking care of the problem. And I think Michael may talk about that when he talks about endocrine disruption a little bit later. Now, what are some of the barriers that we might have in terms of solving or addressing some of these problems? Well, we heard a lot this morning about the economic issues, although I really took away the idea that without a healthy environment, that predisposes to economic problems. I think that Professor Diamond's mention of the Clean Air Act was one that I was going to mention, where we have a very favorable cost-benefit ratio. In other words, the costs of environmental regulation are dwarfed by the benefits, the health benefits that our population has achieved because of them. Bill Riley wrote a marvelous editorial about a year or two ago in the New York Times, where he detailed examples of how regulations invariably lead to economic benefits as well as environmental benefits once they happen. Unfortunately, what has been the mode of operation has frequently been delay these environmental benefits because of concerns about how much regulations were going to cost. But in fact, when it's been analyzed, invariably, the regulations lead to a positive cost-benefit analysis. The other, and I hope my medical colleagues will take this as a positive suggestion, is I think there's a lack of recognition in the medical community about issues of environmental concern, at least, for example, in our country, where most of our environmental issues we're dealing with, and I'm not talking about when we have a tragedy like has occurred in New Orleans. But in general, in our country, we're dealing low levels of exposure, relatively low levels of exposure, over long periods of time. And we're not looking for blatant, obvious, necessarily health defects. We're looking for changes in risk. So one of the best examples I can cite to you is the lead story. I think you all know that when we removed lead from gasoline, the levels of blood lead dropped dramatically within a year. I mean, it was a tremendous success for regulation. But you couldn't look at little Johnny and say, gee, little Johnny, if your mom had had a little less blood lead, you would have had 2 more IQ points. But you could look at a population of children and find that the children who had less blood lead have a higher IQ distribution. And those are the kind of issues we're looking at. So it's going to be very unlikely for a pediatrician to have a child come into his office and for them to be able to identify that this child has suffered from an environmental poison. But in fact, it's going to be a population basis. It's a public health issue that we need to deal with. And so if we look at the potential role for the Nicholas Institute of Environmental Policy, and I inadvertently left off the solutions because I think that's the most important thing that we're dealing with here, is that we're trying to find out how can we come together? How can we move forward on these issues? And the first thing I would want to say is the issue of stakeholder involvement. We have to bring all the stakeholders together. And that doesn't mean just the industry, and it doesn't just mean the community. It means we need to get everybody together. We need the scientists with the community, with the industry, with, for example, the academics. We need to come together. We need to pursue education, and education in the broadest sense, starting at the youngest level. And we heard that today, how I think many of us know that our science education is woefully inadequate. Environmental education in all its aspects is also. And the third point is communication. We have to get our message out, and we have to get our message across. I think those are the points I wanted to make. Thank you.
Thank you very much. Why don't we move to Michael?
Hey, thank you very much indeed. Let me begin by saying what a tremendous honor it is to be invited to participate in this, in the panel and in the overall meeting. I think I'm the only non-North American on the panel, so doubly thanks for letting me come here. Oh, and there's another one here. Have you? He lives here. He doesn't. But the real point I wanted to make is that I am now going to abuse my position by trying to give you a perspective of environmental and human health problems from Europe, and perhaps an international perspective as well, and the way in which we look towards the US to see what's going on here. 4% of the world's population, and obviously with the current administration, there are all kinds of issues that people in Europe are looking at in the US to see what's going to happen. I think one of the things we've been trying to do in Europe and in the UK over the last few years is look at evidence and trying to build the case for using evidence to inform our policies. And if I might just be, how do I make this work? Is that it? Okay. One of the things I'd like to just raise with you, and I want to be provocative in this brief talk, is to suggest to you that it would be very interesting, wouldn't it, if we made our environmental and human health policies on the basis of faith, if we didn't have evidence at all. Supposing we just decided what we felt we ought to be doing. In this particular picture, you can see there's tremendous air pollution in Britain. This was quite a long time ago, not last week, happily. And we actually took some action that wasn't really based on scientific evidence. We just wanted to clean it up, and so we did. It was kind of an act of faith. And we've heard this morning from one of the speakers about the religious movements that are alive and well in the States that may be driving some of the policies that are going on. And we look in Europe towards that view with some interest, just to see whether it is true that environmental policies in the US are going to be based on evidence. And I think most of you would agree. We'd all feel much more comfortable if it was an evidence-based approach. I think there is actually a model in Europe that we're working on, and I guess it applies here as well, of a science policy logic. We find existing and emerging problems, We then undertake scientific assessments and propose solutions, and then we develop a new policy. I would suggest to you that that's a very simplistic view of the world, and it's not actually how it's working out for us, really. One of the biggest issues we faced in Europe and in the UK in particular is the issue of waste. We have a huge amount of waste to dispose of. And at the moment, we put it in landfill sites. And there are all kinds of problems associated with landfill sites. Not only is the potential for contamination of the aquifers of the local environment, but the human health problems are potentially enormous. A lot of people in socioeconomically deprived conditions live near landfill sites, and there's been suggestions of birth defects in children born to women living near landfill sites and so on and so forth. So huge concerns about that. So this is brought to the attention of the legislators, and in Brussels they issued an EU directive, a European Union directive, which says that we can't continue to landfill. And so the scientists look at solutions, and the scientific solution is clearly, in our view and in the European view, to incinerate this waste. This would mean building 144 new incinerators in the UK alone. You'll see in this diagram that it mentions public opinion as we track back from right to left across the bottom, and of course there's huge protests about it. The most common argument that's used is that when you incinerate waste, you produce dioxins, and dioxins make us ill. So then the response is, well, of course, if you operate an incinerator, a modern incinerator, properly, then you'll get to a position where the release of dioxins and other toxins is minimal and there's no threat. But the public say, yes, we're still worried about the dioxins that come out the incinerator. So there's some kind of debate that goes on there, some kind of discussion of the scientific evidence between the regulatory agencies, the scientists, and the community that's often unresolved. And politicians, of course, then come into the debate, and they don't want to cause any problem that would affect the vote in different countries. And so we're left with a number of difficult situations. So the incinerator is the best option, but what we're actually left with is a policy vacuum. And the policy vacuum is something that's carrying on at the moment. We are also very concerned about the whole issue of endocrine disruption. And this picture just simply shows that we've seen sex changes in fish downstream of sewage works in Britain. We've seen a variety of malformations in marine organisms, the phenomenon of intersex, the superimposition of male characteristics on female snails in the marine environment, and a variety of other things as well. The Environment Agency that I work for, which is equivalent to the US EPA, has produced all kinds of policies on this matter, and we have a pretty heavy debate going on at the moment. We have tried to use organisms in the environment as sentinels to warn us of potential threats to humans. And here's what we know at the moment when we're trying to develop a policy. Pollutants disturb hormone systems in vertebrate and invertebrate species. Changes in human fertility and abnormalities in human reproductive systems may be related to pollution, and there's growing evidence of this at the moment. A recent conference in Copenhagen demonstrated that there were links between phthalates and testicular cancer in young boys and so on. And this has led to a major effort worldwide to identify so-called endocrine disruptors. Now, in the UK at the moment, we've issued an edict that the water companies need to clean up sewage works and clean up the sewage that's coming out of their works so that there are not endocrine disruptors released into the water environment. But this has been highly, highly controversial. The water industry says there's no proof of human effects of endocrine disruptors or these mixtures of chemicals, or that ecological change has taken place as a result of the discharge of endocrine disruptors. The industry does want to know what kind of chemicals are being released in what amounts and what levels they can discharge safely. In other words, they want a target setting and a method developing for measuring every endocrine disruptor chemical coming out of a sewage works. Clearly impractical. The NGOs, many of them are saying very provocative statements that industry is putting the environment and human health at risk by not taking measures forward to remove endocrine disruptors. And there are also questions in society and for politicians. For example, is it acceptable to have fish in our rivers and in our seas that have changed sex due to the release of these chemical pollutants, whether they be components of a contraceptive pill or industrial chemicals or whatever? We now know that in that mixture of endocrine disruptors, there are, many of those so-called endocrine disrupting chemicals actually are genotoxic as well. And in fact, our recent studies show that all the endocrine disruptors we've looked at cause genetic damage too. And also downstream of our sewage works, we're now finding cancer chemotherapy agents in the water supplies. These are not demonstrated to be a particular threat to human health at the concentrations they're at the moment, nor is there any ecological change going on. But I ask you all to consider, would you be happy drinking water that's been abstracted from a river where the fish have changed sex, where there are genotoxic chemicals, where there are cancer chemotherapy agents? So maybe there's some discussion to be had about whether we actually have to demonstrate ecological change or human health effects before we take some action. What should the policy say? I think, in fact, there's a science policy spectrum that we haven't really got out in the open to discuss, but we are now discussing it in Europe. We have long discussions about the precautionary principle. That's taking action where we don't have enough evidence to decide one way or the other. We just take precautionary measures. So if you think about it really, when we adopt the precautionary principle, it's not evidence-based policy. It's precautionary policy. What we're probably trying to aim for is evidence-based policy, but nearly every issue that we address, we have insufficient evidence to be absolutely sure. And we've gone on for many years with issues like climate change and potential flooding and those kind of issues, not really having all the evidence in place that we need to take a decision. So we end up with, I think, this weight of evidence approach, and that's kind of where we are in the UK and Europe at the moment. We're discussing what weight of evidence do you need to take action and what kind of actions do you need to take. And finally, I just want to, well, not quite finally, I just want to rattle through these things very quickly. Nanotechnology has come up on the agenda in the UK very, very much at the moment. A year and a half ago, the government said nanotechnology is not going to be a problem, despite $16 trillion being spent on it over the next few years and around the world. And despite the fact that in 10 years' time, 25% of the production in the world will involve nanotechnology, it was said that everything's fine. It's just absolutely fine. We've got regulations in place. We don't need any extra policies. 18 months later, we have this situation. The Royal Society in the UK commissioned a review, and we learnt these things. Firstly, there are huge benefits to be had from nanotechnology, but there are also potential threats to human health. Exposure, the nanomaterials are often too small to detect. Toxicity, we know that when you configure chemicals in nanoparticles, in tiny particles, you change the chemistry, and we don't know anything about nanotoxicology. We don't know how these chemicals persist, where they go. The current regulatory protection only kicks in if you make a vast amount of it. So if you make a small amount of a nanomaterial, it can be put out in the environment or anywhere else you want. And we're not even clear who should be regulating these things. So here's a kind of another policy vacuum. It's exacerbated by the media. This is an item from the Financial Times where it was said, the title was "Why Scientists Must Dispel Our Grey Goo Fears." Grey goo was the term that Prince Charles used to describe what nanomaterial would do to our world. He felt if they escaped to the environment, everything would turn to grey goo, and we've been battling that ever since. But industry is certainly worried about this kind of public debate that's coming in place. And finally, I'd just like to add to something that Linda was saying about developing countries. We're very clear in the UK and in Europe that we must address the problems of developing countries. And you can see that there are going to be huge increases in world population, perhaps over the next 30 or 40 years, a doubling of the population. 90% of that increase will be in developing countries. Most of those people live by the coast and are dependent on coastal fisheries and so on. Those fisheries are already in decline. Where will the sewage go? What about the industries that are moving to take advantage of cheap labor forces in developing countries? Who's going to regulate all this lot? And where are the policies that are going to be put in place to do this? We feel that we must start to engage in in these things. I won't go through all this. So what can we do, and what can the Nicholas Institute do? Well, I think that the comment that was made earlier is the most important one. That is that the Nicholas Institute can be an independent organization, an authoritative organization that can present clear scientific evidence upon which decisions can be based. I think that is hugely important, and it can be a beacon for the world. We need to develop new ways of communicating with the public. The media is not the way to go, because the media are only looking for stories. They're not interested necessarily in educating the public. Politicians need to be better informed. In my experience, the level of ignorance among politicians is breathtaking. Lord May, the president of the Royal Society in Britain, described many politicians as being gutless, because although they know what the scientific evidence is, they're not willing to stick to that evidence in terms of implementing policies. They're bending and waving to media pressure, public pressure, and so on. Policymakers need to develop a deeper understanding of science and what scientists can do, and I think the Nicholas Institute can help there. And we need to train a lot more scientists to understand policy issues and policy needs. But we also need to just remember that some scientists are not going to be engaged in that agenda. And some of our greatest scientists, some of the Nobel Prize winners, really don't care that much about the public agenda, the political agenda. They just want to do good science, and we have to find a place for them too. So thank you very much indeed.
Thank you. Larry?
Thanks very much to the Nicholas Institute for inviting me to participate on this panel. I have the great good fortune to call both Michael and Linda friends and colleagues, so was able to anticipate to a certain extent what they might talk about, and fear that I might end up being a little bit repetitive. And so I was originally going to talk about children's environmental health issues, and Linda covered many of those topics well, and I chose instead to sort of on the fly give you a little bit of a presentation associated with the work that my research group, the Children's Environmental Health Initiative, has been doing as part of the National Institutes of Health's rapid response to Hurricane Katrina. To give you a little bit of background on the project, immediately after the hurricane hit, and especially after the levees broke, and our understanding of the degree of flooding and therefore the degree of damage in New Orleans occurred. And also the hurricane affected more than just New Orleans. We were looking at a very wide impact area associated with Katrina. The director of the National Institutes of Environmental Health Sciences, which is one of the National Institutes of Health, it's the only one based here in Research Triangle Park, is so David Schwartz, who is formerly the division director of pulmonary and critical care medicine here at Duke, chose to emphasize what was going on in the Gulf area that was impacted by the hurricane as a major area that his institute needed to pay attention to in terms of environmental health impacts. Out of this concern was born, there were a whole series of conference calls. Rich DiGiulio, who's on our faculty, was a key player in all of this, trying to figure out how could we do a better job of understanding what exactly happened with the hurricane in terms of the environmental health impacts associated with it. And out of these series of conference calls came the notion of building one of the things that became immediately obvious was there was no central data repository or analytical repository where all the information you needed to analyze things like what are the impacts of having floodwaters scour the agriculture street Superfund site, what are the potential health impacts of that, what are the potential health impacts of all of the toxic chemicals associated with gasoline stations being flooded, or all of your household hazardous waste sort of floating out into the 12 feet of floodwaters in various places, as well as some of the potential ecological impacts. So it became very clear that we needed to have a structured data and analytical resource in place that would, number one, allow first responders, people who were going in to care for those who were, whose health was threatened by the immediate effects of the hurricane, and also the people who came in, who are following in close behind, who are trying to start the rebuilding process to figure out what can we do to support those efforts. But then, and most importantly from the perspective of what people on this panel might be interested in, there are going to be, we know from our experiences here in North Carolina associated with Hurricanes Dennis and Floyd, we know that there are going to be long-term environmental health impacts associated with Hurricane Katrina, and we need to do a better job of getting all of the data that we need in place and getting the kind of analytic strategies in place to appropriately assess those impacts and use that knowledge to change our policy practice. So that's a little bit of background on the project, and I loaded a little, so all of this project that I'm going to show you is the result of a collective effort of between the University of California, San Diego State University, and our group here at Duke. We are, there's actually a 40 terabyte server that sits out in San Diego where we're gonna stand all the data up on that server, and all of this information is going to become available to anybody in the research or policy community who wants to answer particular questions. And we're going to provide opportunities for people to collaborate across, across state boundaries, across university boundaries, those types of things. But I won't go into all of the IT speak about how we do collaboratories, which is like when you're so geeky that you think you're cool again, is what you call it. But what I do want to do is show you a little bit of the GIS work that we've done so far. So you will surely recognize this. It might be helpful to bring the lights down, up front down a little bit, if you could do that. You will surely recognize this part of the United States. Here is Louisiana, Mississippi, and Alabama. What I have outlined there, the black lines represent the thick black lines are the state boundaries, the thin black lines are the parish and county boundaries, and the blue on there, the dark blue, are the outlines of the watersheds, and the light blue are the actual hydrography there. Just to give you a sense, so this entire area that I'm showing you, there was significant impact from the hurricane throughout much of this area. And to give you a sense of, well, so what do we have to worry about? Hurricanes have been around for a very long time. What exactly is the problem? Well, here are the kinds of facilities that, through which this hurricane made its path. So if you want to see all of the oil and gas wells, okay, these are all of the oil and gas wells in Louisiana, Mississippi, and Alabama. So, and the path of the hurricane sort of landed just so here and then, moved up in this direction. So as you can see, there are a lot of oil and gas wells in this area, and you have significant wind damage, significant rain damage occurring here. Now, alternatively, if you wanted to see all the platforms out in the Gulf, here are all the Gulf platforms. Okay, so you say to yourself, how come there are so many down there in Louisiana and there aren't any further to the east? Actually, the first thing that you say to yourself, which is, I want to give special thanks to Sharon Edwards, Alicia Overstreet, and Andy Hull, who work with our group, we've all been working a lot of hours, so if my head clunks down on the laptop, just say, somebody yell out, Lynn, someone from FEMA's on the phone. But the first thing that Sharon said when we put all this data together was, how do they get the boats through that? Because there are an awful lot of these platforms out in the Gulf, and the potential for small spills or even larger spills is fairly significant. All right, so those are the Gulf platforms. Throughout this area, you can see, here's all the national priority list sites. So these are Superfund sites. These are hazardous waste sites that the government has identified as some of the most significant areas of hazardous waste contamination in the country, and there are a significant number of them down here. And if you add on top of that the tri-reporting facilities, which are all of those facilities that emit enough toxic air pollutant, that emit enough toxic pollutants that it triggers the emergency Planning and Community Right to Know Act's Toxic Release Inventory reporting requirement. All of those red stars represent places that are emitting significant amounts of toxic pollutants. And you say to yourself, there seems to be this sort of line that runs along here. What is that line? That line right there is the Mississippi River. So I'm going to actually show you a few other things and then zoom in on the New Orleans area a bit more. This represents, these orange dots represent where we have significant chemical industry facilities, particularly those associated with pesticides and agriculture. If you want to see where the drinking water surface intakes are, that's where they are. So they are, you'll note that there's a whole line of these drinking water surface intakes that runs exactly along the same line of where we had some national priority list sites as well as this tri-reporting sites are. These are all the hazmat locations in this area, and this, I'm going to take some of these off because the map is getting messy, and I don't like it when maps are messy. Here's where all the refineries are. So again, you can see there's that telltale line, and that's the Mississippi River. Here are all the places where pipelines cross roads. So if you think about this notion of impervious surfaces and underground pipelines and those types of things are important. We can also show you where all the crude petroleum and natural gas operations are. There are a lot of them in this area, as well as the petroleum product storage. Okay. Now what I want to do is zoom in on the New Orleans area for you. Okay. And take this off and put on a different layer. And this layer right here provides you with information on the damage as of, this is from an assessment that was done on August 30th. It doesn't show up that well at the moment, so I'm just going to change this on the fly. Sorry. Okay, so you can see that a little bit better now. That kind of pinkish reddish area, pinkish reddish. That's how one of my daughters never calls something a particular color. It's always pinkish reddish or brownish bluish. So this is an assessment that was done by a variety. This is compiling a bunch of different information from different government agencies, showing the extent of the damage. And what you can see that this area in here that's got that pinkish reddish cross-hatching is all areas that were under floodwaters. So I'm going to zoom in a little bit more here. And to give you a little bit of to situate yourself a little bit in New Orleans. So there's the Superdome, that little flag right there. That's where the Superdome is. This is the Mississippi River down here. This is Lake Pontchartrain up here. And between here and here, it's actually below sea level. And so it's like a little saucer. And not surprisingly, especially after the levees broke, there was significant flooding in these areas. Now, the notion that there would be significant flooding in these areas was not just predictable, it was in fact predicted. It's not a surprise to anybody who is sort of looking at some of these disaster preparedness issues. But to give you an even better sense of how what we're doing is designed to maybe improve some of what's going on, I'm just going to add on here. This right here is aerial photography that we've, it'll take just a minute to load, that we've superimposed on top of all of this other data. And it'll take a minute to load, and I'll just give my concluding remarks and then show you something on here. So what's the relevance of all of this for the Nicholas Institute? There's any number of policy failures that have occurred here. I'm not going to go into, why do we have a city that's 10 feet below sea level, because it would be disingenuous of me because I have eaten beignets on the at a sidewalk cafe, and I understand, why it is that we have a city that's built 10 feet below sea level. But there is, in my mind, some astonishing remarks to be made about our lack of preparedness for this. This was not predictable, it was predicted. We knew it was going to happen. In the wake of 9/11, we were supposed to be doing all kinds of things to prepare ourselves for these kinds of, quick response kinds of events. And I find it leaves me fairly breathless, Michael, that, they had to find some, GIS chick from Duke to put all these data layers together. I don't know why all these data layers weren't put together already. I don't know why my research group is fielding calls from FEMA and the American Red Cross and those types of things. We're happy to do it. We are delighted to have something constructive to do in the face of this overwhelming destruction. It's a tremendous relief opportunity for us to participate so directly in it. But there is something wrong when we don't have the right kinds of systems in place to have this information beforehand. So I think the whole notion of having information infrastructure as well as using this information infrastructure in a very sophisticated way to evaluate the human health impacts, the ecological health impacts, the kinds of things that my colleagues Rich and Dave and Seth will do is absolutely critical for us. And I'm going to conclude. I'm just going to zero in on the area around the Superdome, and I'm going to put on this layer that has all the gas stations on it, and you're going to actually be able to see the floodwaters here. So you'll start building up this notion of how you could connect all these spatial data layers to do a better job of understanding the potential human health impacts. But while I'm doing that, there's no reason for the panel not to continue.
Okay, thank you very much. I should say that Lynn's work, I've seen a lot of really exciting work, particularly in the Durham area, when she's able to use the same GIS to look at susceptible population lead levels in different houses, different regions. I think it's really a very, very exciting system. So we've had 3 very exciting presentations. We have about 10 minutes for a panel discussion. Let me, because this is about health, and because I think, Linda, you talked a little bit about, the medical community. Tell me a little bit about agency relationship. You are both in environmental agencies. We have NIH and a variety of human health, human services agency. How should they partner together, and how can Nicholas Institute be a player in trying to inform and influence the policy, if not the collaboration between agencies?
Well, I think first of all, the Environmental Protection Agency in our country is both an environmental and a public health agency. Our goal is to protect the environment and public health. In distinction with, for example, NIH, which solely has a research mission, our mission is also regulatory. And in fact, the research arm of the agency is a pretty small part of the agency. It's only about 10% of what we do. But our work is targeted to address the issues so we can make more informed regulatory decisions. And we need to partner with the public health agencies whose sole mission is public health and research in order to get much of the data that we need. So for example, maybe some of you have heard of the CDC report card, which gets released every year or every 2 years, which is a report of what are the chemicals that are present in Americans, and every year we find that there are more chemicals, and part of that is an analytical issue. We now are able to look for more chemicals. We have greater sensitivity to detect lower and lower levels, and we look for more things. And one of the key things that we need to understand before we run out and try to regulate all these chemicals is there a potential health risk here? And so we need the information not only on what the levels are in people, but we need to understand what the potential risk of these are in order for us to make a better decision. So there is a lot of interaction going on between the agencies. We need to continue it. What I really see as the real opportunity for this new institute is the issue of an honest broker, where, again, as I said, getting all the stakeholders together, because there are some people who think that if you're working for a government agency, you have an agenda. And I could say our agenda is to protect the public health and the environment, but so to bring us all together in a completely neutral kind of environment is very important, and somehow the Institute is going to have to work very hard to maintain their clear independence.
Speaking of partners and players, you mentioned about NGOs. Can you sort of give me a perspective of how you see that, in terms of perhaps extracting the very best out of NGOs versus, working with them in very complex issues, as you can imagine?
Yeah, for us, the NGOs play an incredibly important part in bringing to public attention various issues. But of course, there's a danger that they can also distort issues and priorities by bringing things into the public arena. But with the very best NGOs that we work with, we have a very good dialogue with them. And in fact, sometimes they can even be a vehicle for bringing things to public attention. We too have a problem of the research budget that we have. The Environment Agency is essentially a regulatory agency, but fortunately we have a very far-sighted chief executive, Baroness Barbara Young, who wants to make it into a champion of the environment as well. And she's identified the environment and human health area as an area where no other organisations in the UK are currently operating, and so she's led us into that area with the support of a number of NGOs. And the whole idea of chemical mixtures in people is one of the ones that we're pursuing too. But just to add a small point to that, one of the dialogues that we're getting going is with the environment agencies in the other European countries and with the NGOs in other European countries to kind of try and formulate a European network and view on these issues. The most difficult point I think we've encountered at the moment is that the medical community, when they see funds available for environment and human health research, very, very much want to focus it on the diseases themselves. And that's not what we want to do. We want to look at the relationship between the quality of the environment and human health. And getting that balance right is a major challenge.
One last question, and I want to open for a panel discussion. I think you've shown us some very interesting technology, and you mentioned, Michael, about nanotechnology. Who should develop the tools, the analytic tools, for us to monitor the environment? Should Nicholas School be involved with some of these technological development, or what should it be doing?
Well, I think there are, depending upon the kinds of tools and the kinds of monitoring you need done, that it's inevitable that what we need is a partnership between sort of pure researchers like you might find in the academy, people in the government sector, and also people in the private sector who are in the business of, who have a whole variety of incentives to innovate new technologies for monitoring and sensing different kinds of contaminants, as well as the technologies that need to be put in place for modeling the fate and transport of chemicals as they move through the environment. So I think inevitably the answer is that all of us have to be involved, and I think that that we all have to give a little bit in terms of what our usual way of operating is. Academics can't have to decide that it doesn't in fact sully them in any way to get directly involved in answering real policy questions and affecting policy practice. And similarly, both the private sector and the public sector have adjustments to make as well in terms of how we can make things work collectively. But Michael?
Well, I just wanted to add a small point that I think a major role for the Nicholas Institute might be in facilitating kind of demonstration programs, because one thing that's clear in Europe is that regulatory agencies don't change their practice unless a very, very compelling case can be made for using new technologies, new ideas, new approaches. And the only way of getting those things in place is by demonstrating alongside current practice the advantages and benefits of new practice. And if you really want to get solutions, then I think you have to demonstrate that they're cost-effective, advantageous, and really taking us somewhere. And I think the Nicholas Institute could do something in that regard.
Thank you. Are there questions from the audience? Yes?
Yes, a question for Professor Miranda. You mentioned Hurricane City, North Carolina, and you've done some studies on the health impacts. Could you just say a couple things about what you found?
Sure. So one of the things that I would emphasize about Katrina is we're spending a lot of time thinking about the sort of immediate toxic exposures that people are experiencing because of the literal soup that's out there. But one of the things that we learned from North Carolina was that even after housing had been rehabilitated and you went into it and it seemed like, well, this seems like the housing is fine, we started discovering that there were rapid increases in rates of respiratory health problems throughout the areas that had been flooded. With this, part of this got flagged by a school nurse noticing that about 2/3 of the kids in a middle school down east that had been flooded out were all exhibiting asthma or asthma-like symptoms, and this led to a reinvestigation of the school, which seemed fine, but was actually the bioaerosol load in the school was extremely high, and this led us to look at housing stock that had experienced significant water intrusion events and discovered that the kind of bioaeroallergen loads in those houses is extremely high and can sensitize high enough to potentially sensitize people to develop kind of reactive airways or other respiratory problems, and is especially problematic for people who are already sensitized.
Questions? Yes.
Certainly a major theme of the Institute in this meeting is the relationship between the health of the environment and human well-being. Talked about the relationship to economics, and with this particular panel on human health. But certainly a major frustration for me in my career has been really a disconnect between those involved in human health research and so forth, and practice, and those involved in ecosystem analysis and protection, when it seems like the two are clearly connected. And yet I continue not to see major connections between the two. I think it's a huge barrier to the sorts of things this institute is supposed to deal with. Do y'all have ideas on how to overcome those barriers?
Well, I mentioned at the beginning that we can't look at public health and human health in isolation from what's going on in the environment, and I think there are many clear examples. For example, as climate change is progressing, as as we're getting warmer and warmer, we're going to start seeing certain diseases that essentially were restricted to the tropics are going to begin to appear at more and more northern latitudes. We know, for example, that the increase, say, in Lyme disease that we're seeing in many areas are because we've completely taken away the natural predators of deers and we've destroyed their habitats. So now, certainly here in North Carolina, all of us have deers bedding down in their yard all the time. And therefore, there's a lot more opportunity, for example, for contact between species we didn't. We know some of you may remember maybe 10 years ago, there was the hantavirus outbreak out in Arizona. And that was because I believe there was an extremely, I think it was a very, very dry period, and the deer mice left their normal, food places they scavenged for food and came into the wood piles. And in fact, then you had exposure to people, and we had about 20 people who died. And that's because you had changed the basic environment, and therefore you altered the potential for health impacts.
Any other comments, questions? So I think as a physician and as somebody who's thinking about healthcare, you talk about population versus individuals. And you also talk about education and training. Can you expand about how we can idealize this, or at least move it closer to the consideration of when we take care of individual patients, that we take the environmental issues into account? We don't do enough training, certainly medicals, to think about those things. And so that issue versus the research that should be carried out in, say, schools of medicine beyond public schools, School of Public Health, pardon me, to enhance this kind of area.
Well, I think one of the points is that since some of the changes that we believe are occurring, and we have evidence are occurring, we're picking them up in epidemiological kinds of studies. Our animal models frequently give us the biological plausibility to believe the findings that we have. Many of the endocrine disruptor area, there are now studies showing that, for example, young men whose mothers were more highly exposed to pesticides appear to be slightly demasculinized. Well, for that individual male, that may not be a problem, but if you have a whole population, again, you may put more people in an at-risk category. There's an association, for example, between dioxin and type 2 diabetes. Now, we don't want to tell people that dioxin is causing the type 2 diabetes. We know much of it is due to obesity, changes in diet, and as people get older, you have an increased risk. But in fact, is the exposure to dioxin making people more susceptible, so they're getting it at slightly younger ages, slightly not quite as obese, for example. So I think those are the kinds of questions. We need more studies, and we need to train our healthcare providers to be asking the appropriate questions to make the associations.
Well, I would challenge you, Victor, in a potential career-limiting move on my part right now, that there really is a failure on the part of medical schools to train physicians, and certainly physician scientists, on issues of environmental health. And if you sort of add up the number of hours that people spend in medical school and the number of, it's my understanding, having looked at some curriculum, including the one here at Duke, you can count just on a couple of hands, some years just one hand, the number of hours that people are exposed to issues of environmental health. And having people have some sensitivity, especially since there's a whole series of these very subtle effects, which are not necessarily, if someone comes to you, there's not sort of an immediate disease presentation, but somehow or another that people are unwell and looking to potential both physical environment and social environment explanatories for that. I think medical schools, nursing schools, et cetera, have gotten much better about thinking about the social factors that are shaping people's health outcomes, but the environmental factors that are shaping those are equally important.
Last comment, Mike.
Yeah, I suppose my comment is related more to the research agenda. I think there's a common research agenda between environmental toxicology, ecotoxicology, and medical toxicology. I think there's a huge potential for using organisms in the environment as sentinels of threats to human health. After all, clams get tumors, organisms get sex changes and so on, that can signal human exposure to things. And I think that putting together the eco-epidemiology with the human epidemiology has huge potential for alerting us to things. And I'd like to see much more of that kind of work being done and bringing the two areas together.
Thank you. Let's thank the panelists for a great discussion.